In this nursing video, we'll be focusing on developing a pulmonary care plan for a patient with the nursing diagnosis of acute pain. This topic is particularly important in pulmonary care because pain can impair respiratory function, leading to complications like atelectasis or pneumonia. We'll cover related factors, defining characteristics, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing acute pain in pulmonary patients. Common related factors. Acute pain in pulmonary patients is often linked to several underlying issues. These include inflammation or irritation of pulmonary tissues. This could be due to infections like pneumonia, pleuritis, or thoracic trauma. Post-operative pain, particularly after thoracic or abdominal surgeries where incisions can interfere with breathing. Increased work of breathing, seen in patients with COPD, asthma, or acute respiratory distress syndrome. Pleural effusion, fluid accumulation in the pleural cavity increases chest pressure, causing discomfort. Hypoxia or tissue ischemia, reduced oxygen levels lead to cellular distress, contributing to pain. Defining characteristics. Patients with acute pain may present with the following: subjective complaints, statements such as, "It feels like stabbing pain when I breathe deeply." Guarding behaviors, avoidance of movement or shallow breathing to minimize discomfort. Vital sign changes, elevated heart rate, blood pressure, and respiratory rate. Nonverbal cues, grimacing, restlessness, or difficulty sleeping due to pain. Limited activity tolerance. Pain restricts the patient's ability to perform basic activities like walking or sitting up. Understanding these factors and characteristics will guide our approach to managing the patient effectively. Expected outcomes. When developing a care plan, it's critical to set measurable and achievable outcomes. For a patient with acute pain, these outcomes may include pain management. The patient will report a pain level of 3 out of 10 or less within 24 hours using a standard pain scale. Improved respiratory function. The patient will maintain oxygen saturation levels above 92% while engaging in deep breathing exercises. Active participation in recovery. The patient will demonstrate proper technique with incentive spirometry at least 3 times per shift. Prevention of complications. The patient will show no signs of atelectasis or pneumonia, as evidenced by clear lung sounds and normal respiratory rates within 48 hours. Setting these outcomes ensures a clear direction for your interventions and allows you to evaluate progress effectively. Ongoing assessments. Next, let's look at 3 critical nursing assessments and the rationale behind each. 1. Monitor pain level frequently. Use a standardized pain assessment tool such as the numeric pain rating scale to evaluate pain intensity, location, and triggers. Rationale. Pain is subjective and can change rapidly, especially in pulmonary conditions. Regular assessments allow timely interventions and help track the effectiveness of pain management strategies. 2. Assess respiratory status continuously. Observe respiratory rate, depth, effort, and pattern. Look for signs of accessory muscle use or nasal flaring. Measure oxygen saturation levels using pulse oximetry, and if available, evaluate arterial blood gases or ABGs. Rationale: pulmonary pain often results in shallow breathing, increasing the risk of hypoxia and carbon dioxide retention. Ongoing respiratory monitoring is essential to prevent complications. 3. Check for signs of complications. Auscultate lung fields for diminished breath sounds, crackles, or wheezing. Assess for signs of atelectasis, such as reduced chest expansion or uneven breath sounds. Rationale: patients in pain are at higher risk for secondary issues like pneumonia or pleural effusion due to limited mobility and shallow breathing. Early identification allows for prompt treatment. Therapeutic interventions. Finally, let's discuss 3 nursing actions to alleviate pain and improve respiratory function, along with their rationales. 1. Administer prescribed analgesics. Provide medications such as acetaminophen, NSAIDs, or opioids, for example, morphine, as ordered. Use a multimodal approach when possible to minimize opioid use. Rationale: effective pain control encourages deeper breathing and improved mobility, reducing the risk of respiratory complications. Be vigilant about side effects like respiratory depression, particularly with opioids. 2. Encourage and assist with positioning. Position the patient in a semi-Fowler's or high Fowler's position to promote chest expansion. Provide pillows or other supports to help with comfort. Rationale: proper positioning reduces pressure on the diaphragm and enhances lung expansion, making breathing less painful and more efficient. 3. Facilitate deep breathing exercises and incentive spirometry. Teach the patient how to use an incentive spirometer and guide them in performing deep breathing exercises at least 3 times per shift. Pair this with relaxation techniques to reduce pain perception. Rationale. These interventions prevent atelectasis, improve lung function, and build confidence in managing pain associated with breathing. 4. Provide non-pharmacologic pain relief measures. Offer methods such as guided imagery, music therapy, or applying heat or cold packs if appropriate. Rationale. Non-pharmacological interventions complement medical treatments, providing holistic pain relief and reducing the need for high doses of analgesics. Well, that ends this lesson. To wrap up, managing acute pain in pulmonary patients involves identifying related factors and defining characteristics, setting clear, achievable outcomes, conducting ongoing assessments to monitor pain and respiratory status, and implementing therapeutic interventions to address pain and improve lung function. By using this structured approach, you can effectively support your patient through recovery while minimizing complications. Thanks for watching. If you found this video useful, click here for another nursing video.